All right, today we're tackling a big one, the story of type 1 diabetes. Now, this condition affects millions of people, but honestly, it's pretty misunderstood. So we're going to get right into it. What it is, what's actually going on inside the body, and what managing it day to day really looks like.
But before we get into the specifics, let's start with a really mind-bending question. What happens when your own body turns on itself? I mean, what if your personal security system started attacking the good guys? That idea right there is the key to understanding everything about type 1 diabetes.
So that question leads us straight into our first section. What is type 1 diabetes really? Let's get right to the heart of the problem. Okay, that definition sounds pretty textbook, right? Let's break it down into plain English. See that phrase, autoimmune destruction? That basically means your body's immune system gets confused and starts attacking and destroying these super important cells in your pancreas. And that leads to the next part, absolute insulin deficiency. It's exactly what it sounds like. The body has completely lost its ability to make its own insulin. It's just gone.
And you really got to get this part. This is so important. This is not the type of diabetes you might hear about being linked to diet or lifestyle. It's not about the body resisting insulin. With type 1, the insulin factories themselves have been, well, they've been destroyed. They're shut down. And without insulin, that whole critical process of getting energy from your food into your cells, it just completely grinds to a halt.
So how does that shutdown even happen? That brings us to part 2, the body's internal attack. And really, you can think of it like a wild case of mistaken identity happening inside your own body. Okay, so this is the chain reaction, and it is devastating. First, the immune system attacks, right? It wipes out its own beta cells. Boom. Step 2, insulin production just stops. And since insulin is like the key that lets sugar into your cells, all that glucose gets trapped in the blood. Now you've got 2 huge problems happening at the same time. Your cells are starving for energy, and your body, in a panic, starts burning fat for fuel instead. The problem is, this creates a really dangerous byproduct called ketones.
And this quote just hits it perfectly. It's the ultimate paradox of type 1. You've got all this fuel, all this sugar, just floating around in your blood, but your cells can't touch it. They are literally starving in the middle of a feast. That's the core crisis going on.
So how does the body sound the alarm? How does this internal chaos actually show up on the outside? That's section 3, the warning signs. And you should really think of these as the body's alarm bells going off like crazy.
All right, the classic symptoms are often called the 3 polys. Sounds technical, but it's simple. First, there's polyuria. That's just a fancy word for peeing a lot. Why? Because your body is desperately trying to flush out all that extra sugar. Of course, that leads right to polydipsia, or being incredibly thirsty because you're losing so much water. Then there's polyphagia, extreme hunger. That's your starving cells screaming for energy. And the weight loss? That happens because your body is literally burning through its own fat and muscle for fuel.
And there are other signals too, all tied back to the same root cause. Feeling exhausted all the time? Well, yeah, your cells have no fuel. Blurred vision? That can happen when high sugar levels actually pull fluid out of the lenses in your eyes. See, every single one of these symptoms makes perfect sense when you remember that core problem. The cells are just starving.
So how do doctors know for sure? Well, it really comes down to the numbers. A key test is a fasting blood sugar test. And if that number comes back at 126 or higher on more than one occasion, that's the diagnosis. It's a hard, clear sign that the body's sugar management system has failed. Okay, so we've talked a lot about the problem. Let's switch gears and talk about the solution. Section 4 is all about the daily management plan. This is where people take back control of a job their body just can't do anymore. And let's be crystal clear about this first point. Since the body can't make insulin, it has to be replaced from the outside. This isn't a suggestion, it's not optional, it is absolutely 100% essential for survival. So, good management really comes down to these 4 pillars working together. First, you've got insulin therapy, obviously to replace what's gone. Then there's managing your diet, especially carbs, to match that insulin. Physical activity is huge too. It helps the body use sugar way more efficiently. And finally, glucose monitoring. You have to be constantly checking your blood sugar to know what adjustments to make. It's not a set it and forget it thing. It is a constant 24/7 balancing act. So what's it actually like to live with this every single day? In our last section here, we're going to talk about the realities of this lifelong journey.
Living with type 1 really means you're managing risks on two fronts. You have the short-term dangers, right? Things like hypoglycemia, which is when your blood sugar goes dangerously low, or the opposite, DKA, when it's dangerously high. But then you have the long-term chronic stuff. Over years, high blood sugar can slowly damage the tiny blood vessels all over your body, leading to really serious problems with your eyes, your kidneys, your nerves, even your heart. And that is why that daily balancing act is so incredibly important.
And this brings us to a really tough but crucial fact. Because type 1 is an autoimmune disease, probably caused by some combination of genes and something in the environment, as of right now there's no known way to stop it from happening.
So that leaves us with one last, really big question. If we can't prevent it, then what does the future of living with type 1 even look like? Well, that future is being written as we speak. It's being shaped by amazing technologies like smart pumps and monitors that are total game changers. And it's being driven by nonstop research that's pushing for better treatments and, maybe one day, a cure. When you get right down to it, the story of type 1 diabetes isn't just about a disease. It's a story of incredible human resilience in the face of a relentless internal fight.